Hi there, ladies and gentlemen. Welcome to a video about the anatomy of the ventral side muscles of the lower arm. We're going to talk about these 8 muscles. And as you may see, I've grouped them in 3 groups. 1, 2, 3. The reason why I did this is because of the spatial orientation of each muscle group. With this being the deepest, this is a bit more superficial, and this is the most superficial. Another reason why I grouped these is because these muscles have their origins at the medial epicondyle, or at least at the medial epicondyle, maybe other places, but this is the most important origin. So it's pretty relevant to group these muscles, and it's nice for studying purposes. Now let's take a look at the origins and insertions of each of these muscles. And we're going to start with the Pronator Quadratus. The Pronator Quadratus, PQ, has its origin at the distal ulna and its insertion at the distal radius. So it looks like this. The nice thing about the Pronator Quadratus is that its name says something about its shape and about its function. It's quadrangular, and it pronates. As this is its origin and this is its insertion, it means that the insertion, that's basically the definition of insertion, is that it is the part of the bone muscle system that moves mostly, that is the most mobile when the muscle contracts. So when the Pronator Quadratus contracts, the radius is moved this way. So when you put your arm in front of you with your palm facing up and you contract your Pronator Quadratus, you are going to be pronating your arm. So that's the most deep muscle. Next we have the Flexor Pollicis longus. The Flexor Pollicis longus is a bit more superficial, but not the most superficial. The Flexor Pollicis longus has its insertion at the base of the distal phalanx of the first digit, and its insertion in the interosseous membrane and the anterior surface of the radius. So for purposes of simplicity, let's say that the Flexor Pollicis longus has its origin on the proximal radius. When we draw a line, we see that this is how the Flexor Pollicis longus is shaped. Next we have the Flexor Digitorum profundus. The profound digital flexor has its origin on the posterior and medial borders of the ulna and the interosseous membrane. So it has a pretty extensive origin, but for purposes of simplicity, let's say that the Flexor Digitorum profundus has its origin here, and its insertion is on the distal phalanges of the 2nd to 5th digits. So it has a common tendon here, which then branches to the distal phalanges. Now this is very important. It inserts on the distal phalanges. Where there is a profound digital flexor, this is the Flexor Digitorum profundus, there is also a superficial digital flexor. The superficial digital flexor has its origin on the medial epicondyle, but also on the proximal ulna and the middle of the radius. But for purposes of simplicity, let's just say that the Flexor Digitorum superficialis has its origin here, on the medial epicondyle. It inserts not on the base of the distal phalanges, but at the shaft of the middle phalanges. So the profound digital flexor inserts on the shaft of the middle phalanges. And so it runs like this. We have it, and we branch towards the middle phalanges. Now this is relevant because basically this muscle allows the hand to flex without flexing the distal phalanges. So that's the Flexor Digitorum superficialis. The superficial flexor of the digits, the 2nd to 5th digits more specifically. Then we have the pronator teres, the pronator teres. Let's see, the pronator teres, as it's the most superficial muscle group, origins at the medial epicondyle and inserts on the lateral radius. So this is the pronator teres. Again, the name says something about the function, pronation, and the shape, teres. Teres means long and round. And it's an important anatomical term, also in abdominal anatomy, it's important. Then we have the flexor carpi radialis, which again, medial epicondyle, and it inserts on the base of the 2nd and 3rd metacarpal, the flexor carpi radialis. Maybe I'll use another color for this. I'll use yellow. So this is the flexor carpi radialis. Inserts here. It's the flexor carpi radialis. And then we have the palmaris longus. The palmaris longus also inserts on the medial epicondyle. And it inserts on the palmar fascia. And the palmar fascia, or the palmar aponeurosis, is a fascial sheath with this outline. This is the outline of the palmar aponeurosis. Just let me make this more clear with the pink color. And an aponeurosis is a sheath of fascia where muscles can insert. So the palmaris longus, it inserts right here in the apex of this palmar fascia. And then finally we have the flexor carpi ulnaris. The flexor carpi ulnaris, origin medial epicondyle, insertion, 3 insertions, the pisiform, the hook of the hamate, and the base of the 5th metacarpal. So it comes like this, this, and this. This is the flexor carpi ulnaris. So this is a pretty complex drawing, and of course when I draw over the old muscles, maybe the drawing won't be as clear. But what I'm trying to illustrate here is that there is a layered topography, a layered structure to the muscles of the forearm, with the most deep being the Pronator Quadratus, and then above that these 2 muscles, and then above that these 4 muscles, or 5 muscles. And I think this is a great way to study anatomy, is by looking at these muscles in groups, compartments. And so I've added this table, and I hope that this was of educational value to you.